I was really weak after surgery. I got up to get my glasses and fell.
I didn't want to bother the nurses by pushing the call button.
The medication made me so groggy and disoriented.
My cell phone was across the room and I tried to answer it.
My walker was just out of reach and I lost my balance.
I just wanted to go to the restroom by myself.
It happened so quickly.
I fell.
I
fell.
When it comes to the prevalence and seriousness of falls, the numbers are alarming. Every 17 seconds, an older adult is treated in a hospital emergency department for a fall-related injury. Every 30 minutes, an older adult dies as a result of injuries from a fall. It's a nationwide health problem that affects everyone. Falls can happen anytime, any place, and hospitals face unique challenges due to the fragile health status of patients. That's why Methodist Health System's Fall Risk Reduction Program is so important. It's a team approach that involves all caregivers at all Methodist hospitals.
Our commitment at Methodist on all of our campuses is really patient safety. It's a priority. And so when you take a look at fall risk reduction, our goal is to work as a team, no matter who you are on that team, what employee you are in the hospital, to keep patients safe.
To put the scope of the issue in context, every year between 700,000 and 1 million patients fall while in the hospital, and between 1/3 and 1/2 of those falls result in injury.
You can do everything right, have everything in place and intact, and a patient still can fall.
When you have a patient that has fallen and they're under your care, you feel completely responsible, when in actuality, you could have done everything right but still have that patient fall.
The reality is, every hospital patient is a potential fall risk.
There are a lot of risk factors. They're in a different environment, they're in a different bed, they have different medications that maybe they've been used to at home, and it's just a different surrounding, and their disease process all puts them at risk.
In a hospital environment, all falls and near falls are a serious matter. According to the Joint Commission, one serious fall-related injury adds 6 days to a patient's hospital stay and an average of $13,000 to the cost of care. But the human cost can't be measured in days or dollars.
The prevention of fall injuries is really important because oftentimes patients are so happy and ready to leave and then have an injurious fall, which then sets them back by days within the hospital and weeks with recovery at home.
For older adults, a fall can start a devastating downward spiral. The prognosis is especially difficult for those who suffer hip fractures. Half never regain the same level of functioning, and nearly 1/3 die within 6 months. It's one of the reasons it's critical to know who's at greatest risk.
The first thing in terms of risk factors, we take a look at their age, their history of falling, their cognition or their mental state, things related to, for example, secondary diagnoses, different medications that they could be having if they have IVs, what their level of ambulation is. All of those play into identifying who's at greatest risk.
Something that's commonly overlooked is the effect of medications. Oftentimes, patients don't realize the effect that medications can have on them. Medications can cause things like confusion, dizziness, fatigue, malaise, mental depression, headache, things that can really increase a patient's risk for falls.
Identifying the patients at the highest risk for serious injury requires caregivers to ask a simple set of questions. Does the patient meet any of the ABCs? Is the patient age 85 or older? Does the patient have brittle bones or osteoporosis? Is the patient on anticoagulation medication? And has the patient had surgery?
So when we have a patient that comes into the hospital, any of our hospitals, and they have one of the ABCs, it puts them at not only greatest risk for possibly a fall, but if they do fall, for an injurious fall. So we really put interventions in place to prevent injury. Not all falls are preventable, but it's still a very high priority in terms of what we need to be doing for patient safety.
Knowing which patients are in the highest risk category is key to keeping them safe. Safety is a primary concern because a single fall can kill. Less than 1% of hospital falls result in death, but that means nationwide, 11,000 fatal falls occur in hospitals each year. A fall that causes the death or serious injury of a patient is a sentinel or never event, something that should never happen in a healthcare setting. But these kinds of events do occur, leaving families distraught and caregivers inconsolable.
I was at the core desk and I heard a thud from all the way down the hall, and I could hear his head hit the floor. And he cut his eye, and he had a big black eye, and it bruised, and he did have to stay longer and had more tests done. And how he got up out of bed and out into the hall, none of us know.
It's just a terrible, devastating feeling to have a patient fall under your care.
I still hear that sound all the time. I actually have dreams about it. And it just makes me want to keep everybody else safe and really evaluate each person individually and make sure that we're doing the best we can for each individual.
The Falls program at Methodist Health System is an evidence-based team approach. It's a partnership with patients, families, and hospital staff.
When a patient comes through our doors, we do implement some universal precautions which are meant to reduce the risk of falls and injury for that patient while they're with us.
Universal precautions include emphasizing use of the call button to call before you fall, ensuring patients wear non-skid socks or shoes when they are up and about, and reducing environmental hazards and personal care concerns during hourly rounding.
Literally anyone can fall. We do have fall precautions, and some people are on higher fall precautions than others, but anybody can fall at any given time, and so that's why you need to be focused.
It's just so important to use all the interventions that we have in place to alert other staff and to alert yourself. I mean, if somebody's at severe risk for falls, everything we do is just a piece of that puzzle, and if one of those pieces aren't there, then the puzzle doesn't look right. And it's just drilling in that importance of all the interventions in place and how critical every piece is.
On a daily basis, the care team evaluates every patient to determine their fall risk using the Morse Fall Scale. This screening tool looks at and scores a series of factors related to fall risk. The higher the overall score, the greater the risk. Patients scoring over 45 are identified as at high risk for falls. Patients with a score over 60 are considered a severe risk.
Once we have identified a patient as a severe fall risk, we do have a bundle of interventions we will implement that help keep that patient safe.
The interventions are simple but important. The care plan is adjusted to reflect the fall risk. The patient wears yellow socks and a yellow wristband. Nursing staff ensure that bed and chair alarms are put to use. A staff member attends to the patient in the bathroom because safety trumps privacy. And patients who are known fallers, which means they've fallen in the last 30 days, get a special sign on their door.
The yellow socks are incredible because they have the no slip on the top and bottom, so that helps them to get their bearings. The yellow armband are important because it tells us and it alerts other staff, even if they're not taking care of the patient. Hey, I see yellow socks, I see yellow armband, they're up in their room by themselves. I need to go check on them. And then if there's a sign on the door that says they're a known faller in the last 30 days, then we really know we gotta get in there.
Nurses and CNAs are the first line of defense when it comes to fall risk reduction, but all hospital staffers who come in contact with patients have a role to play.
From nursing to food service to housekeeping, we are all a team. We all have to work together.
When I see a yellow sign on the door, we know that we have to watch out for the patient. You know, and that means a lot to a patient when we go an extra step to help them. And it means a lot to us too.
Part of the Methodist philosophy is that every fall or near fall is a learning opportunity.
With fall huddles, we get a group of people in there. There's the nurse, the aide, the charge nurse, and a pharmacist. And we try to look and learn from what happened so we can prevent it from happening again.
Training and teamwork can make a big difference in the outcome when an incident occurs.
I think the team approach is very important with everything we do because you cannot do anything by yourself. You know, you need everybody helping watch, you need everybody helping look at things, and maybe one person doesn't think of something, but somebody else does. There's nothing we can do that's going to prevent every fall, but we want to alleviate as many as we possibly can.
What can we do better next time? How can we make this a safer environment? How can we make this a safe place for patient care?
Every year, nearly 300,000 patients come to our hospitals, trusting their lives and health to us and our culture of safety. Having every member of our team work together to keep our patients safe from falls and fall injuries, that's the meaning of care.